Our world is now facing a big pandemic challenge. The coronavirus COVID-19 outbreak that was originated in Wuhan, China, is now deadly affecting hundreds of countries and territories around the world, and one international conveyance, the Diamond Princess cruise ship, harbored in Yokohama, Japan. Over 100,000 people had been infected, and thousands have died from COVID-19, the illness that the virus causes. National health security is fundamentally weak around the world, and while some of the countries and territories that have experienced coronavirus cases are better prepared to handle a major pandemic than others, no country is fully prepared for epidemics nor pandemics, and every country has important gaps to address. This is according to a comprehensive report assessing the state of readiness for a major disease outbreak. On today's video, we will be presenting to you the top 10 well-prepared countries for a pandemic according to the Global Health Security Index. The Global Health Security Index presents the results of an assessment of global health security capabilities in 195 countries prepared by the Johns Hopkins Center for Health Security, the Nuclear Threat Initiative, and the Economist Intelligence Unit. It was first published in 2019. The Global Health Security Index was released and had examined whether countries across the continents are prepared to deal with epidemic or pandemic. The index analyzes those preparation levels by focusing on whether countries have the proper tools in place to deal with large-scale outbreaks of disease. Measured on a scale of 0 to 100, where 100 is the highest level of preparedness. As the coronavirus continues to spread and shake countries around the world, here are the top 10 countries best equipped to handle an epidemic or pandemic according to the report. Slot number 10 is Finland with a total score of 68.7. Since 2012, Finland has every time ranked at least in the top 5 of world's happiest countries in the annual World Happiness Report by the United Nations. Finland, with a population of 5.52 million as of July 2019, got very high scores for its international commitments to fighting diseases and its overall socio-economic resilience, but surprisingly, it is scored below average on its ability to exercise emergency response plans. Getting the number 9 slot is of course South Korea with an overall score of 70.2. When the coronavirus started to spread in Asia in January, South Korea became second to China in terms of the number of infected cases, but because of the massive and innovative resiliency programs and immediate actions, they were able to slow down the spread of the virus until now. According to the Global Health Security Index report, South Korea has very robust disease detection and reporting systems. Number 8 is Denmark with a total score of 70.4. Denmark is considered to be one of the most economically and socially developed countries in the world, so it's not surprising that this Nordic country will score high in the Global Health Index. Denmark's laboratory systems, real-time disease surveillance and reporting, and data sharing between different health sectors were all very highly scored. Another Nordic country on the list is Sweden, taking the slot of number 7 with an overall score of 72.1. Sweden, an Scandinavian country in Northern Europe, is the 16th richest country in the world in terms of gross domestic product per capita, and a high standard of living is experienced by its citizens. Sweden of course had high scores in nearly all the metrics in the Global Health Security Index, but its communications with healthcare workers during an emergency were rated poorly. A big surprise for Asians, Thailand took the number 6 spot. Thailand is the only middle-income country and the only country from Southeast Asia to score in the highest tier with an overall score of 73.2 of the Global Health Security Index. How did Thailand get a remarkable score? The country shows robust healthcare capacities, ranking second across all nations for indicators relating to healthcare access. It is also one of only 5 countries demonstrating a public priority for providing healthcare services to healthcare workers who become sick while responding to public health emergencies. Thailand's biosafety practices links between public health and security authorities and capacity to test and approve new medical countermeasures were among the areas for which the researchers gave the country top scores. However, the report suggested that the country faces a worse than average political and security risk environment. Taking the number 5th spot is Canada with an overall score of 75.3. Canada is the world's 10th largest economy as of 2018, with a nominal GDP of approximately 1.73 trillion US dollars, and according to the Canadian Institute for Health Information, the healthcare spending is about 11.5% of Canada's gross domestic product. Hence, according to the Global Health Security Index, Canada's disease detection and reporting systems were very highly rated by the researchers, as well as the country's overall risk environment, including its political and socio-economic instability. Number 4 is Australia with an overall score of 75.5. Australia's life expectancy is the 3rd highest in the world for males and the 7th highest for females. Total expenditure on health, including private sector spending, is around 9.8% of gross domestic product. According from the GHS Index report, Australia's disease detection and reporting was very well rated, with top scores for the country's laboratory systems, real-time surveillance and reporting, epidemiology workforce, data integration between human, animal, environmental health sectors. However, the country sadly received the lowest score for its ability to exercise response plans. Adding the 3rd spot is the Dutch country Netherlands with an overall score of 75.6. Health insurance in the Netherlands is mandatory and was ranked first in the study in 2009, comparing the healthcare systems in the United States, Australia, Canada, Germany and New Zealand. The Global Health Security Index lets Netherlands receive top scores for its capacity to test and approve new medical countermeasures, risk communication, and links between public and health and security authorities. The country also had near perfect scores for healthcare access and socio-economic resilience. Ranking number 2 is United Kingdom with an overall score of 77.9. The United Kingdom is the 6th largest economy by nominal GDP and 9th largest economy by purchasing power parity. It was the world's first industrialized country and the world's foremost power during the 19th and early 20th centuries. Regarding its healthcare in the United Kingdom is a devolved matter, and its country has its own system of private and publicly funded healthcare. Public healthcare is provided to all UK permanent residents and is mostly free at a point of need, being paid for from general taxation. From the Global Health Security Index review, the UK received the highest score among all 195 countries in the study for its rapid response capabilities, with perfect scores for exercising response plans, links between public health and security authorities, trade and travel restrictions, and risk communication. Grabbing the 1st spot is of course the United States with an overall score of 83.5. On February 27, 2020, President Donald Trump held up a map based on the GHS Index showing the United States was the best prepared country in the world for a pandemic. However, one of the consultants working the project, Priya Bapat, pointed out that even though the US does rank at the top for the index, there are areas where there is room for improvement, notably access to healthcare. The US had the highest scores among all 195 countries in the study in several categories, including prevention of the emergence of release of pathogens, early detection and reporting of epidemics, and overall health system capacity. However, the country's score for healthcare access was below the global average. Despite the country's high score on this ranking, the US government's response to the coronavirus outbreak has come under criticism from public health experts and others. Testing rates in the US have been much lower than in the other countries affected by the virus, meaning that the extent of the outbreak remains unclear.